A local hospital is announcing that its CEO has tested positive for coronavirus. Fox 61's Aisha Mbowe has more on how Bristol Health is responding to the diagnosis of its leader.
Hospitals around the state doing what they can to keep up with the rising COVID-19 cases.
So we have 122 who are positive and 98 who are possible. We're waiting for the test results. If you put the numbers together, it's about 220. Out of 220, 92 of them are on ventilator.
Over the last 2 weeks, we've definitely seen a surge of admissions.
According to Dr. Stephen Choi, he says there are currently approximately 360 patients across the Yale New Haven hospital system, 90 of them in the ICU, with 70 requiring ventilation.
We do have capacity now.
But the hospital officials say that could very well change with the anticipated worst-case scenarios if the number of cases surge in April.
There have been models anywhere from 15th of April to end of April. We could see the surge.
You know, our current ICU capacity, our ventilator capacity, and even our general medical surgical floor beds where the non-ICU patients have to go. If those all become overwhelmed, we have diversion plans to accommodate additional patients.
Many hospitals around the state are still taking precautions like mandatory screenings for both limited visitors and employees, like at Bristol Health.
Every time an employee goes into the hospital, they have their temperature taken. If it's more than 100.4, they have to leave and leave work.
2 staffers have tested positive for COVID-19 at Bristol Health. The most recent, the hospital's president and CEO.
He was feeling symptoms late Friday and eventually went in, had testing done here on our specimen collection site.
Hospital officials we spoke with say thanks to donations and preparations in place, they are currently okay with the number of things like testing and protective gear for at least the next week or 2. But they urge people continue to social distance so it can remain that way.
This is the one thing the community can do to help us, which is to slow down the spread so that we can pace out and spread out the number of patients.
And I also asked all 3 I interviewed today about any plans on putting out a call for extra staffing at this time, and they say they can always use the extra staffing. Hartford Health says to go ahead and call their central staffing office, and the rest say they are doing it through the state right now. For now, reporting in Hartford, Aisha Mbowe, Fox 61 News.